it is time for 814 Your Health. October is American Pharmacist Month, and did you know this? There are an estimated 1 million cases of shingles in the United States every year. So we're joined alongside two gentlemen who are going to let us know why adults 50 years and older should talk to their local Giant Eagle pharmacist about their risk of shingles and about prevention. We're joined alongside Dr. Leonard Friedland, who is the Vice President and Director of Scientific Affairs and Public Health at GSK Vaccines. And then joining us as well is Fred Ben-Savengo, who is the Senior Director of Pharmacy Operations of Giant Eagle. Gentlemen, welcome into the show.
Thank you.
Thank you.
Okay, so first things first, we're talking shingles. For people who aren't super familiar, what exactly is shingles?
Yeah, thanks, Jack. So shingles is a disease that's characterized with a painful, blistering rash that can last weeks. And in addition to the rash and the pain, the disease can be very disruptive to our lives, to our work, to our social lives, to sleep, to our hobbies. It can be very disruptive. Now, the disease is caused by a virus, and that virus is the herpes zoster virus, which is the very same virus that causes chickenpox, a disease we associate with childhood. But while we recover from the disease chickenpox, the virus stays in our body. It goes dormant, but it can reactivate years later. And when it reactivates, it causes this painful, blistering rash, the disease we call shingles. Now, why would this virus reactivate? The major risk factor, Jack, is advancing age, particularly 50 years of age and older. As our immune systems naturally weaken, it will allow this virus to have the opportunity to reactivate. And as we age, we are at increased risk for many infectious diseases, including shingles. But Jack, in addition to advancing age, other risk factors include some chronic medical conditions that are associated with an increased risk of shingles, and those include diabetes, asthma, COPD, heart disease, and chronic kidney disease.
All right, yeah, definitely some things to look out for, but that's why it's important to talk about these things. And Fred, I want to bring in you now because you're here to talk about how Giant Eagle pharmacists can help people better understand their risk.
Yeah, that's correct. You go out into a pharmacy today. We're doing a lot of flu shots, a lot of COVID shots. We like to say it's flu shot season. Shingles really doesn't have a season, so to speak. Like the doctor was mentioning, it's if you're 50 years or older, especially with those risk factors. But even if you're just 50 and older, young, and you feel young and healthy, you're still at risk. It's a lot more prevalent than we think. There's about 1 million cases each year that are diagnosed. So, what better way, and I think you can start off this month being American Pharmacist Month, it's a perfect time to remind everybody out there the essential role pharmacists play just in supporting health and well-being overall in our communities. Being one of the most trusted healthcare providers who can assess people's risk for vaccine-preventable diseases, like shingles, for example, and help guide conversations, with your physician about it. So again, just to drive the point home, if you're over 50 years of age, be proactive and talk to your local Giant Eagle pharmacist about your risks for shingles and about prevention.
Right, yes. I guess what questions should people be asking the Giant Eagle pharmacists about shingles, Fred? What things should they be addressing with them?
Let me start off this way by answering that. I think I talked a couple of seconds ago with flu shot season. Shingles not really being a season. So if you want to categorize something into a season, it's football season. So we'll call it shingles preseason. It's still nice outside. You can get it 365 days a year. But as the weather starts getting colder, as we start moving into the holidays, as we start, sitting closer together inside, then all of our risks for any of these preventable vaccine diseases are out there. So I think what's important is if you're in the pharmacy and you're getting a flu shot, maybe speak to the pharmacist about other shots that you should be taking. And for this call, there's how to prevent shingles. Any shots, a lot of vaccines can be given co-administered, which means you can get one or more. I would talk to them about risk factors. How do I go about? I know in some stores you have to make an appointment. In Giant Eagle, you can just walk in. Any shots available out there. So if you have any questions, I would recommend either calling, walking in, visiting our website, or just visiting easyvax.com. It's EASYVAX.com.
Excellent. And doctor, I wanted to ask you, so just in terms of what people need to know about this vaccine option, just what are the key things that folks should know about that, and whether this is the right option for them?
Absolutely. So health and wellness is so important. We should take all opportunities when we're interacting with our healthcare providers, our primary care physicians, our local pharmacists, to ask about prevention. What can we do to keep ourselves healthy as we age? And there are a number of vaccine preventable diseases, including shingles. So take the opportunity to have those discussions with your healthcare providers, learn about vaccine preventable diseases, including shingles. And as Fred mentioned, there's a website you can go to, easyvax.com, EASYVAX.com. You can put in information about where you live and learn about what vaccines are available at the pharmacies near you.
Very important things to keep in mind. And like they talked about, there really is no shingles season. So no better time than now. Right, guys, gentlemen, thank you very, very much. We really appreciate it.